Welcome you all to yet another episode of Aster's Let's Talk. The topic of the day is hemorrhoids, which is commonly known as piles. To discuss on the same, we have with us Dr. Yogish, General Surgeon, Aster Hospital, Qatar. Hello, Doctor.
Hello.
Doctor, to start off, can you just let us know what are these hemorrhoids?
Yeah, first of all, most of the people don't know about the hemorrhoids. They don't know it is a venous disorder. So basically, it's a venous abnormality, which is a vein protruding through the anus region, and that causing a problem and irritation to the patient, and that is basically a venous disorder.
Okay, Doctor. Basically, what are the symptoms of piles?
Most commonly patient comes with bleeding, bleeding per rectum, and moreover basically it's a mass per rectum, and a lot of irritation and itching will be there in the anal region, and patients comes with difficult to walk and difficult to go for bathroom and difficulties, a lot of like naturally it's a daily process will be hampered.
So, usually, what are the causes of piles, Doctor?
The most commonest cause, basically, patients will spend a lot of time in the bathroom. That is the most commonest problem the patient will have. And constipation is the cause for the this thing. And most nowadays, intra-abdominal pressure increase. Like intra-abdominal pressure increase means secondary to pregnancy, secondary to obesity, and a lot of lifestyle changes have made, lifestyle modifications like lifestyle abnormal problems have made this hemorrhoids to occur.
When a person should seek a doctor or come and think of visiting a doctor?
Basically, there is a lot of classifications for hemorrhoids, grade 1 and grade 2 and grade 3, grade 4 nowadays. And probably with the initial small hemorrhoids, they are called internal hemorrhoids. And internal hemorrhoids need not be approached to the doctor. Patient can have a remedies at the home itself. When they have a bleeding, when they have a pain, and when the mass is coming completely out of the anal orifice, and when they are unable to do a normal activity, then definitely patients has to like approach a doctor. And bleeding is the one, though it is not a hemorrhoidal bleeding, we have to confirm what are the types of bleeding. Like bleeding can be due to other disorders like Crohn's, ulcerative colitis, or ulcer, or some other etiology. Could be a cancer, anal cancer. So bleeding is most important, and moreover mass which is coming protruding out completely, and that is actually it's a 4th degree and 5th degree or 4th degree, those patients has to approach a doctor.
Okay, sir. So, what are the usual complications that arise because of this?
Commonest complications are with the hemorrhoids are anemia, and a lot of blood loss will cause anemia. That's one thing. And patients very late, like if they are not getting the treatment at the early stage, they can cause a thrombosed hemorrhoids. The blood will get clot, and patient unable to tolerate that pain, and the pain, and it can cause a severe infection. And a lot of infection can cause, like severe infection at the anal orifice can lead to a hepatic abscess, liver abscess, and those are the complications of the hemorrhoids.
Doctor, you did mention a word, modifications.
Yeah.
So, any diet modifications we need to do so that you can prevent piles?
Absolutely. Today's world has come out with a lot of westernized food, and definitely diet modification is needed. You like unlike like lifestyle changes are hampering all the other diseases. Likewise, you have to reduce weight, obesity. You have to come down from the westernized food, and you have to have a lot of fiber diet to your diet. And moreover, you should have at least 3 to 4 liter of water every day. And these are the modifications you should have. Okay.
In this modern era, what are the treatments that is available to treat piles?
Yeah. In fact, today we are sitting here to discuss about the latest treatment aspect of the latest treatment for the piles. And thing is, here we have a lot of medications. Medically, we can treat a grade 1 and grade 2 hemorrhoids, and then we need not to go for the surgery as such. And grade 3 means mass is coming out completely, and it has got a bleeding, and it patients has got a severe pain, and those definitely need a surgical intervention. Initially, you can use a lot of ointments that are available in the market, and you have painkillers, and you have a jellies. Like jellies means they are called local anesthetic jellies. That can be used, and they are mixed with mild steroids, and they will help you for the grade 1 and grade 2 hemorrhoids. But grade 3 and grade 4 obviously okay, have to be dealt with surgery, and innumerable surgeries are available okay, today in the our allopathy. And thing is, to start with, there are n number more than okay, we are offering almost you can say around 7 to 8 8 surgeries, and out of that okay, we do a simple banding, and that is okay, application of the simple rubber band okay, to the piles, and that causes the necrosis of the piles, and piles will be fell off, and that's a simple one, and as such okay, it doesn't require anesthesia. And after that we have a laser, and laser is the one which is with the laser we are burning the piles. We are currently okay, we are burning. This can be applicable for smaller piles, okay, internal piles. And now we have a infrared IRC, we call it as IRC, that's called infrared coagulation. That is also a kind of okay, laser. And after that okay, we have a HAL, that is HAL means okay, hemorrhoidal artery ligation. It is basically done by ultrasound guided okay, instrument, and we ligate the artery under anesthesia, and or without anesthesia also can be, it is possible, but the local anesthesia it is possible. And operative surgeries are only two, that is open hemorrhoidectomy, that is called as okay, openly like okay, the surgeon will take under anesthesia, all the piles will be dealt with okay, surgery, and that is open surgery. And now the latest surgery is a stapler hemorrhoidectomy, which is okay, less painful and daycare surgery. Patient can go home on the same day, and the recurrence rate will be comparatively less in stapler hemorrhoidectomy. So these are all the surgeries we can offer, and few of them they are under anesthesia, and most of them okay, laser and other daycare surgery like a cryosurgery, they are all under the local anesthesia can be dealt.
Doctor, you have any message for the viewers who are watching the show? Any lifestyle modifications that really need to focus on, so it will be beneficial
Obviously,
for them?
I definitely tell you about one thing, and obviously you have to modify your diet. You have to add at least okay, 25% of your diet should be a fiber diet. And after that okay, a patient should be carefully watching if they have a symptoms like bleeding, and bleeding has to be evaluated by a surgeon, and they should approach a nearby surgeon or the general physician who can dealt you, who can send you a proper surgeon, and you can go for the minimal investigations and you can get done the treatment. So, and we are come out with stapler hemorrhoidectomy, which has got a daycare surgery, which we are offering okay, at the daycare surgery means okay, patient can come day morning, and within next day he can join for his duty. I mean, or 2 days, whether 1 or 2 days okay, patient here they can go for their normal work, and that is the message okay, today I want to give you.
Thank you so much, Doctor. Thanks for spending your time with us. And viewers, do post in your queries regarding hemorrhoids, and Doctor will be answering all your queries. Thank you so much.